Have you ever wondered if the way you touch yourself after 60 might actually be damaging your body instead of helping it? I know that sounds alarming, but after more than 15 years of working as a urologist, I've seen countless men come to me with circulation problems, prostate inflammation, and even permanent loss of sensation, all linked to one thing: never adjusting their habits as they aged. Masturbation itself isn't unhealthy after 60. In fact, when done correctly, it can protect your prostate, support blood flow, and preserve sexual vitality. But here's the danger: your body changes dramatically with age. And if you keep using the same approach you did in your 20s, what once felt harmless can slowly rob you of sensitivity, energy, and confidence. That's why in this video, I'll expose the 3 critical mistakes men over 60 often make. I'll share the safer method I teach my patients, and I'll explain the exact warning signs that mean it's time to see a doctor immediately. Stay with me, because the next few minutes could change not only how you think about self-pleasure, but how you protect your long-term sexual health. When men tell me, "Doctor, I've been doing this the same way for 40 years. Why should I change?" Now, my answer is always simple: because your body has already changed, whether you realize it or not. Science shows that after 60, testosterone doesn't just slowly decline, it free falls. Blood vessels that were once flexible and springy stiffen like old rubber bands, slowing the rush of blood you need for an erection. And your nerves, they no longer fire like lightning. They crawl, meaning signals from your penis to your brain take longer and sensitivity feels dulled. I once treated a 67-year-old patient who came to me convinced he was broken. He felt almost nothing when touching himself and thought it was just age taking away his masculinity. In reality, it wasn't that he couldn't feel. It was that he was trying to force a 20-year-old's rhythm on a 67-year-old's nervous system. Once I explained the changes and guided him into gentler, slower methods, his sensitivity began to return. He told me, "Doctor, for the first time in years, I actually enjoyed it instead of fighting with my body." Here's the truth: masturbation after 60 can still protect your prostate, preserve circulation, and even lower stress hormones, but only if you adapt to the new biology of aging. If you don't, the very habit meant to keep you healthy could slowly damage the very systems you depend on for sexual vitality. And that's the trap most men fall into, ignoring the subtle changes they push harder and tighter, thinking it's the solution. But that instinct is exactly what leads to the first critical mistake, one that can silently damage your nerves for good. So let's dive into it, because this is where most men start losing the battle without even knowing it. The first and most dangerous mistake I see men over 60 make is gripping too hard. It usually starts innocently. Sensitivity drops, so instinct says, squeeze tighter, push harder. But that instinct is a trap. When you clamp down too hard, you're not just touching yourself, you're crushing the very nerves and blood vessels that make pleasure possible. Imagine trying to water a garden by stepping on the hose. The harder you press, the less water flows. The same thing happens to your penis. I've treated men who confess they could only orgasm with an iron grip so tight it would actually hurt a partner. One man, 64 years old, described his experience as chasing a ghost. He squeezed harder and harder, but the sensation never came back. What he didn't realize was that years of pressure had caused microtrauma to his corpus cavernosum, the spongy chambers that fill with blood, and to the fragile nerves wrapped around them. This leads to what we call pressure-induced neuropathy, permanent nerve damage. Science confirms this repeated compression of penile nerves reduces conduction, velocity meaning signals reach the brain slower or not at all. Over time, numbness sets and circulation weakens, and erections become less reliable, not more. The solution isn't to force more pressure, it's to retrain your nervous system. I coach my patients to practice what I call pressure titration. Start with the lightest touch you can feel, even if it feels frustratingly soft. Hold it for 10 to 15 seconds. Give your nerves time to fire. Then build slowly, never to the point of squeezing the shaft flat. Think massage, not mechanical grinding. This simple shift has rescued countless men from the downward spiral of numbness. And once they break the cycle, they discover something shocking lighter. Stimulation often feels more powerful than years of heavy-handed habits. But pressure isn't the only hidden danger. There's another trap men fall into, one that doesn't just hurt nerves, but also overworks the very gland that fuels their sexual health. And if you've been ignoring your prostate, this next part may surprise you. The second mistake is one most men never see coming, trying to keep the same frequency they had in their 20s. I can't count how many men over 60 have told me I still do it every day, sometimes twice. Isn't that healthy? And the answer is no, because after 60, your prostate and your hormones don't recover the way they used to. Here's the science your prostate produces: about 30% of your semen packed with enzymes and proteins. At 60, that gland needs more time to refill. Forcing it to work daily is like running a marathon every single morning on an empty stomach. You burn out. I've seen men develop chronic inflammation, discomfort, even benign prostate enlargement simply because they never gave their body the recovery window it now needs. One of my patients, 61 years old, came to me complaining that his orgasms felt empty, his energy drained, and his mood dark. When I asked about his routine, he admitted to masturbating every day to stay healthy. What he didn't know was that frequent ejaculation was disrupting his testosterone rhythm, throwing off luteinizing and follicle-stimulating hormones. I guided him to space out his sessions every 48 to 72 hours. Within weeks, his orgasms were fuller, his energy improved, and his mood stabilized. He told me, "Doctor, I feel like I actually enjoy it again instead of just checking a box." The message is simple: quality beats quantity. Every 48 to 72 hours is optimal for most men, and some find that twice a week feels even better. By giving your prostate hormones and nervous system time to reset, you get stronger, more satisfying experiences instead of the drained emptiness of overuse. But here's the twist. Even if you slow down and avoid pressure, many men still stumble into one more trap: the silent destroyer that doesn't attack your hormones or nerves, but your very skin. And if you've ever skipped lubrication, you might be closer to this problem than you think. The third mistake is one of the most overlooked, yet it causes some of the worst long-term damage: skipping lubrication. Many men tell me, "Doctor, I've never needed it before. Why start now?" And that's exactly the problem, because after 60, your body no longer produces the same natural fluids it once did. What felt fine at 20 can turn into micro tears and infections at 60. Here's the science: with age, testosterone declines, and the Cowper's glands produce less pre-ejaculate, the natural fluid that once protected your skin. At the same time, penile tissue thins and becomes more fragile. When you masturbate dry, you're dragging skin on skin, creating friction that can cause microscopic tears. You can't see them, but bacteria can. And once infection sets in, you're dealing with balanitis, chronic inflammation, or even scar tissue that permanently reduces sensitivity. I had a patient, 65 years old, who came to me embarrassed because he kept getting painful swelling after masturbation. He thought it was an allergy. In reality, Years of dry friction had created scarring around the head of his penis, making every touch feel raw and uncomfortable. When he finally switched to a gentle, unscented, water-based lubricant, not only did the infection stop, but he actually rediscovered sensation he thought was gone forever. The fix is simple but powerful. Always use a high-quality, water-based lubricant, unscented, free from parabens and harsh chemicals. Avoid oil-based products if you use condoms, since oil breaks down latex. Think of lubricant as not just comfort, but protection for the most delicate tissue you have. A small tube can prevent years of damage, but lubrication alone isn't enough. Technique matters just as much, and that's why I've developed a complete framework. I teach all my patients a method that turns self-pleasure from something risky into something restorative. And once you hear this care method, you'll never approach masturbation the same way again. After seeing so many men repeat the same damaging habits, I knew I needed a simple framework, something my patients could remember and follow every time. That's how I developed what I call the care method. It's not just about avoiding mistakes. It's about turning self-pleasure into a routine that protects your health instead of threatening it. C stands for cleanliness and comfort. Before you even begin, your body needs to feel safe. Wash your hands thoroughly, make sure your environment is clean, and choose a comfortable position. I always tell patients, don't sit on hard chairs that compress nerves. Instead, recline or lie on your side so blood flow stays open and uninterrupted. A stands for appropriate technique. This means applying lubricant first, starting with light pressure, and keeping movements slow and deliberate. Think of it as massaging your body, not forcing it. Alternate hands, shift grip angles, or use a sleeve device to avoid repetitive strain. The goal isn't to get it over with, it's to give your body time to respond naturally. R stands for respect, timing, and recovery. Men over 60 need longer sessions to feel satisfied, and that's normal. Aim for 15 to 20 minutes, letting arousal rise and fall in waves. And don't rush back the next day. Your prostate and hormones need 48 to 72 hours to reset. Respecting that cycle is what transforms frustration into fulfillment. E stands for evaluate constantly. Pay attention to how your body feels during and after. If something hurts, burns, or feels different than usual, don't ignore it. Those warning signals are your body's way of asking for help, and early attention can prevent permanent problems. When men follow care, I see remarkable transformations. One of my patients, 63 years old, told me he felt 10 years younger just by slowing down, using lubrication and respecting recovery. For him, it wasn't just about pleasure, it was about reclaiming control over his body. But even with the right method, there are red flags you should never brush aside. Some changes point to deeper medical problems that require immediate attention, and ignoring them could cost you far more than sensitivity. So, let me walk you through the danger signs every man over 60 must know. Even when men finally start using safer methods, some wait too long before asking for help. They think pain or numbness is just part of aging. Let me be clear, it's not. Your body has a language, and if you ignore it, the consequences can be permanent. The first red flag is pain that lingers more than 30 minutes after stimulation, whether it's sharp burning or throbbing. Pain is your body's alarm system. Ignoring it is like silencing a fire alarm while the house keeps burning. The second is sudden changes in sensation, new numbness, tingling, or a strange burning that doesn't fade within hours. That's often a sign of nerve compression, the same type of damage I've diagnosed in men who use too much pressure for years. Third, watch for visible changes swelling, odd discoloration bumps or discharge. If it's yellow-green or foul-smelling, that points to infection. One patient waited weeks before coming to me with a discharge he was embarrassed to mention. By then, the infection had spread and required far more aggressive treatment than if he'd spoken up sooner. Other urgent signs include urinary changes, trouble starting or stopping painful flow, or sudden increases in frequency. Add to that any bleeding, no matter how small. I've had men tell me they thought just a drop wasn't serious. Trust me, it is. And finally, persistent changes in erection quality. If you suddenly can't achieve or maintain an erection like you used to, it could signal a circulation issue that needs immediate evaluation. As a doctor, I want to reassure you, there is no shame in speaking up. We've seen it all. Early intervention can stop small problems from snowballing into life-altering conditions. But here's the uplifting part. Avoiding these dangers isn't just about damage control. It's also about building a stronger foundation for long-term sexual health. And that's where lifestyle choices come in. Because the truth is, your daily habits outside the bedroom often matter just as much as what happens inside. Over the years, I've learned that what happens outside the bedroom often shapes what happens inside it. Men are quick to focus on techniques or supplements, but they forget that stress, poor sleep diet, and inactivity can quietly sabotage their sexual health just as much as bad habits during masturbation. Take stress, for example. Chronic stress floods your body with cortisol, which directly lowers testosterone and dulls arousal. I've had patients who swore their problem was physical, but once we address their stress and anxiety, their sensitivity and desire returned almost naturally. It's proof that your mind and body are deeply connected. Then there's timing. Testosterone is highest in the morning, which means morning self-care often feels more satisfying. But some men prefer the evening, using it as a way to relax before bed. The key is to notice when your body feels most responsive and work with it, not against it. Lifestyle plays a huge role too. Moderate exercise, even something as simple as 30 minutes of walking a day, improves circulation. A balanced diet, rich in vegetables, lean protein, and healthy fats, supports hormone balance. And let me be blunt, alcohol and smoking are silent killers of erectile health. I've seen men reclaim function just by cutting back on alcohol and finally quitting cigarettes. And don't underestimate the power of sleep. Poor sleep wrecks hormone production and makes arousal harder. Addressing issues like sleep apnea or restless legs can be as important as anything else I've mentioned today. In short, your body thrives when you treat it with respect every single day. But here's where it all comes together. Once you combine lifestyle improvements with safe techniques, masturbation after 60 isn't just about avoiding damage. It becomes a powerful way to protect your health, your confidence, and your connection to your own body. And that's why, before we finish, I want to leave you with one final message that ties everything together. A message that could change the way you view your sexuality for the rest of your life. So let me wrap this up for you. Masturbation after 60 isn't the enemy. It can be a powerful tool to protect your prostate, improve circulation, reduce stress, and keep your sexual vitality alive, but only if you adapt. Remember the core principles we've talked about today. Slow down, be gentle, give your body time to recover, and never skip lubrication. Respect your body, and it will reward you with years of confidence and comfort. I want you to know there is nothing shameful about caring for this part of your health. You deserve to age with dignity, with energy, and with a sexuality that still feels alive. And if you ever notice warning signs, don't wait. Talk to a doctor early because small problems are always easier to fix than big ones. If this video helped you, save it so you can come back anytime you need a reminder. And make sure you subscribe and turn on the notification bell, because I'll be sharing more medical insights designed to help men over 60 protect their health and vitality. Give this video a like if you found it useful, and tell me in the comments, what was the most surprising thing you learned today? I read every response, and your feedback helps me know what topics to cover next.